Hello.
Hello, my name is Julia. I'm a registered nurse and a student nurse practitioner who will be assessing you today. Go ahead and start with your name and birthday.
Nick 061494.
Okay, go ahead and tell me the month and year and what we're doing today for you.
November 2020, you're gonna be assessing me.
Okay, so as you walked in, I noticed that your gait is very smooth, your balance is good, and your posture is very good, erect, no slouching. You don't appear weak on one side or the other. So we're gonna do a head to toe assessment. I'm gonna start with your head, move on down to your body to your toes, okay?
Okay.
So first I'm gonna start with your head. I'm gonna look through your scalp, look at your hair for any lesions, masses, and you're gonna just let me know if you have any tenderness anymore while I'm going through your hair. And as I'm going through your hair, I see it's equally distributed. I don't notice any dry patches, bald spots anywhere or anything like that. So I'm gonna move on down to your face. I'm gonna check for your symmetry. I'm gonna check cranial nerve number 7, the facial cranial nerve. Go ahead and lift your eyebrows for me, and go ahead and smile. Good. Next, I'm gonna check your trigeminal nerve and your masseter and temporal muscles. So you're gonna go ahead and clench your teeth. Good. And I want you to puff out your cheeks. I'm gonna press down. Good. You've got good musculature there. I'm gonna go ahead and close your eyes. I'm gonna test for some sensation on your face. Real quick, this feeling is soft, and this other feeling is the cut end of a Q-tip, and it's sharp, okay? So I want you to identify what you're feeling.
Soft. 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 Sharp. 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 Sharp.
Okay, you can open your eyes. We're gonna move on down to your eyes. I'm looking at your lids, your lashes, and your eyebrows. I don't notice any exophthalmos, which is your eyes bulging out of place from like hyperthyroidism. Your eyebrows and your eyelashes are evenly distributed. Okay, I'm gonna go ahead and assess for some cranial nerve, extraocular movements and convergence of your eyes. So I want you to follow my finger with nothing but your eyes. And I don't notice any nystagmus or anything like that. Your eyes move symmetrically side to side, and all your extraocular movements are intact. Next, I'm gonna go ahead and check your pupillary reaction. I'm also going to check for convergence. So follow my finger inward, and your eyes converge equally. Your pupils constrict when they get close in. So go ahead and look at my nose. I'm going to test your pupillary reaction to light. Good. Both of them constrict. And that one has direct and consensual constriction as well. So test cranial nerve 2 and 3, the optic and ocular motor while you're looking at me. Next is your nose and sinuses. I'm moving down. I'm gonna kind of tilt your head up. Oops. So I'm looking at your nasal mucosa. It's pink and moist. I don't notice any septal deviation. I'm gonna check for some patency of your nose. Go ahead and breathe in and out. Good. Good. And both sides are patent. Next, I'm going to palpate your frontal and maxillary sinuses. So just let me know if you have any tenderness. Does it hurt at all when I palpate these frontal sinuses?
No.
And how about your maxillary ones?
No.
Okay. I'm going to do a brisk tap for percussion of those sinuses as well. Any pain? No pain?
No.
Okay. I'm going to move on down to your mouth. So I want you to just open your mouth. Your lips look good, intact. I'm looking at your mucosa. Everything is pink and moist. Show me your teeth. I don't notice any dental erosion. Your gums look clean and good. They come to the edges of your teeth. Stick out your tongue. Check in your hypoglossal nerve. And go ahead and say, ah.
Ah.
Your tongue and your uvula move, and your tongue is midline with no deviation. So that's good. Next, I'm going to palpate your tonsils and throat. So I'm actually going to move to the back side because it's just a little easier. I'm going to palpate your tonsils here. I don't notice any tenderness, soreness. I'm moving down your throat, and everything feels symmetric. Your trachea is midline, doesn't have any deviation. 1 second, I just want to make sure it's still recording with this pop-up. Okay, sorry. Okay, next we're going to check your gag reflex, so your vagus nerve. Where did my little thing go? So I have my tongue depressor here. So I want you to stick out your tongue and, okay. So that's intact, that's good. I'm gonna go ahead, okay, and I'm gonna go ahead and assess for your thyroid. So right now I don't feel any nodules or fullness or enlargement on one side or the other. Go ahead and take a swallow for me. You swallow? Do it again. There we go. Okay. Yeah, no fullness, enlargement, or nodules anywhere that I can palpate your lymph nodes now. So I'm just gonna come back to the back here, it's kind of easier. I'm going to palpate your occipital lymph nodes, the back of your head, your preauricular, postauricular, and palpate your tonsillar, and your submental, no, submandibular, and then your submental. Okay, your superficial cervical, and your posterior cervical lymph nodes. We're going to move to your supraclavicular. I don't know any firm, hard, fixed nodules. Everything feels good. And next, we're going to go ahead and move on to your heart and lungs and your abdomen, okay? So first we start with the lungs. I'm looking, you have ease of breathing. You don't have any labored breathing. Go ahead and lean forward. I'm going to check for symmetric expansion. I'm placing my thumbs on each side of your midline, kind of your spine. Go ahead and take a deep breath in. And both of my thumbs expand equally, which means you have equal symmetric expansion of your lungs. Next, I'm going to go ahead and feel for a tactile fremitus. Go ahead, every time I place my hand down, just say 99. I'm checking for areas of consolidation and increased vibratory sensation, which would kind of indicate fluid in your lungs.
99, 99, 99, 99, 99, 99, 99, 99.
We're going to do the same thing on the back side, the posterior chest wall.
99, 99, 99, 99, 99, 99, 99, 99.
While I'm back here, I'm going to go ahead and start percussing. We want to hear some nice resonant air-filled lungs. I'm going to go ahead and percuss the front side too. I didn't hear any areas of dullness that raises any concern of fluid in your lungs. Good. Again, now that we're here on this side, I'm going to go ahead and take a listen to your lungs, listen for any adventitious sounds. So every time I place my stethoscope, take a deep breath in and out, but take your time because I don't want you getting lightheaded or anything like that. And I hear some good vesicular breath sounds, no crackling, wheezing, no round tire rails. I'm going to check the back side of your lungs as well, the posterior side. Excellent. Your lungs sound very good. The next thing I'm going to do is go ahead and inspect your chest wall. We're going to move on to the cardiac examination. I don't notice any concavities of your chest wall. On inspection, I can't notice your point of maximum impulse, which would be like around where the apex of your heart is. I'm going to go ahead and feel for that point of maximum impulse, which is usually the 5th intercostal space at the midclavicular line. And I feel it right here under the nipple line almost. And now that I've palpated that, I'm going to go ahead and take a listen to your heart. I'm going to listen first at the aortic space, the 2nd intercostal space. This is the pulmonic space. I'm going to move down to the 3rd, 4th, and 5th intercostal space on this mid-sternal line, or to the left of it. I'm going to move over to the apex. Your heart sounds good. Listening through it, I hear your S1 and S2 sounds. There's no rubs, murmurs, gallops anywhere. There's no S3 or S4. And I'm going to go ahead and have you lay back, and we're going to, watch your glasses. I'm going to inspect for like a jugular venous pulsation. So, I see it happening about right here. We're going to take our card horizontally from the point of maximum impulse. And right now you're measuring at about 1 centimeter. So normal is for that pulsation to be visual under 3 centimeters, so that's good. I'm also going to go ahead and, while you're laying down, I guess, just assess for your carotid pulses one at a time. Good, it's very brisk. It's not diminished in any way. I'm going to go ahead and feel your radial pulses as well. They're symmetric. I'm going to feel for your brachial pulses. Sorry, I know it's uncomfortable. Good, they're symmetric. I'm going to have you slightly flex your knees, and I'm going to assess for the popliteal pulse behind your knees. Okay, it's a little deeper, so it's kind of hard to feel. Right there. Right there, you've got good pulses. And let's go down to your dorsalis pedis pulses. Good. And your posterior tibial. Good. Your pulses are 3+ bilaterally, nice and brisk. They're not too strong or too weak. Real quick, I'm also going to listen to your carotid. So I'm going to have you take a deep breath in and hold it. Good. And what that does is it just checks for any bruise or any narrowing that could indicate stenosis of those carotid arteries. Next, we're going to move on to your abdomen. You can stay laying down, that's easier. So as I'm looking and inspecting, I don't notice any distension or obesity. Your stomach is very, flat, looks good. And after looking at it, I'm going to go ahead and take a listen to all 4 quadrants, starting in the right lower. Listening for vowel sounds, I hear them really well. While I'm here, I'm going to go ahead and listen to your aorta, your renal arteries, and your iliac arteries. I don't hear any bruise that would indicate any stenosis in any of those areas. I'm going to move on next to some light palpation, deep palpation, feeling around in your stomach. So I'm gonna go ahead and start. Let me know if you have any tenderness along the way, okay?
Okay.
I'm not noting any masses or irregularities, any distension or parts of the bowel. I'm gonna move on to deeper, okay? Okay, and actually before I was supposed to do palpation, I know I'm supposed to percuss. We're supposed to listen for tympani. So let's just pretend I did this part first. I do hear tympanic sounds throughout your gut, as we would call it. Where's my measurement? I'm gonna also percuss for the size of your liver, okay? So we're gonna look for the upper border and the lower border at the mid-clavicular line. I'm gonna go down from around the nipple line until I hear dullness. Right here, right there. And then we're gonna start down here and move upward. I'm gonna take my tape measure. Normal at this mid-clavicular line is around 6 to 12 centimeters. So you're at about 9 centimeters right there. I'm also going to check at your kind of sternal border, okay? There. Normal's around 4 to 8 centimeters here. So you're at around 4.5 centimeters. So good. I'm going to have you lay on your right side. I'm going to percuss for the size of your spleen. Go ahead and lift that left arm over. We're going to start at the anterior axillary line. Normally, we shouldn't, unless the spleen is enlarged, we really shouldn't hear a change or any dullness. Go ahead and take a deep breath in. And I don't hear any dullness when you did that either. So go ahead, roll back on your back. You're going to continue on with palpation. Sorry, I don't know where that pillow is. So I'm going to, I've palpated your stomach already. I'm going to go on to the liver. So I'm going to cup my hands under your rib cage, and I want you to take a deep breath in. And I do feel the edge of the liver, just very slightly. It's nice and firm and smooth. We're going to feel for the tip of the spleen, or the head of the spleen as well. So deep breath in. So you can only feel it in about 5% of adults, and I don't feel yours, even though you're very skinny. Okay, so that concludes the abdominal assessment. We're going to go ahead and move on to skin. Go ahead and sit up. So as I'm looking at your skin, I noticed that you're pretty appropriately colored for your ethnicity. Hair distribution on your arms, legs, and stomach and chest are even. I don't notice any dry patches, bald patches. I don't notice any scaling, dryness, or dryness that would indicate like eczema or psoriasis. And no like seborrheic keratosis anywhere in your eyebrows or on your face that I notice. You don't really have any moles, much less abnormal moles. I'm going to go ahead and your nail beds on your toes are pink, and the nail beds on your fingers, go ahead and hold them out. They're also pink. I'm going to check capillary refill, which is just blood return back to that spot that I pushed on. And yours is pretty immediate, which is normal. Your nails don't have any clubbing on your toenails or fingernails. Good. Next, I'm going to check your deep tendon reflexes. So, let me grab my reflex hammer. We're going to start here at the brachioradialis. Just relax your arm, okay? I'm trying to find a relaxed way to hold your arm. Okay, I saw a little flinch right there. That's normal. Oh, sorry. Sometimes it takes a few tries. Okay, I noticed your hand twitch right there. Next, we're gonna move up to your biceps tendon. I noticed a flinch right there in the bicep muscle. And right there. Okay, this is the one I have the hardest time with for some reason. Is the triceps. Just relax your arm. Oh, there we go. Takes a few tries for me still. Relax your arm. Thank you. There we go. Little jerking motion. Next, we're going to move down to your patellar. Okay, there we go. I saw that jerking motion. Move your booty back a little bit. Yeah, let them dangle a little bit more. There we go. Okay, good. Last, we're going to check your Achilles. I'm going to have you go ahead and kind of lay back and cross your ankle over your shin, your opposite shin. Just relax.
You're on my toes.
This one's hard too. Okay, you have jerking of your foot there. Same thing over here. Oh, I missed. Oh, there you go. Sorry for laughing. Okay, next we're gonna move on to your musculoskeletal. I know we said head to toe. This is a little bit easier for me to focus on the other parts, but now we're gonna sit back up. I'm gonna assess your neck range of motion. Bring your head ear to shoulder, ear to shoulder. I want you to turn, look over your shoulder, and turn the other way. Bring your chin to chest, flex, and extend your neck backwards. Look at the ceiling. I'm going to test that against resistance to kind of test the strength of your muscles. So move your head. Good. And rotate against. Good. Good. Bring it down. Good. And bring it back. Good. Next, we're going to do like a shoulder shrug. So I'm going to test your strength there. Bring your shoulders up. Good. I'll have you stand up for the shoulders because it's just a little easier. Bring your shoulder up. And back, and bring it across your body, and adduction, and bring it out, and abduction. Okay, and then I want you to take that arm and bring it over your head and touch the opposite shoulder blade. Awesome, now bring it up and back, over to that shoulder blade. Okay, we're checking for internal and external rotation. Do the same thing, the same motions with that other arm, up, back. Adduction across your body and abduction to the side. Go ahead and internal rotation and external rotation. Bring it up and over, down and back and over. Good. Go ahead, bring your arms forward against resistance. Good, nice and strong. Bring them back. Yeah, okay, there you go. I want you to, there you go, and same thing. Good. Next, we're going to go ahead and move on down to your wrist. So I want you to extend and flex your wrist. Good. I want you to bring them in adduction and out and abduction. And then I want you to supinate. There you go. We're going to test the strength of those. So go ahead and supinate against resistance and pronate against resistance. And bring them in against resistance and out and up. And down. Okay, we're gonna move on to your hip while you're standing. Go ahead and flex your hip up. Good. And extend it back behind you. Full range of motion. Bring it across your body. and out to the side. And then just kind of rotate it up and out, and rotate it out and in. Sorry. I want you to do the same thing on this side. Flex it upward. Good. Bring it back. I know the couch is in your way. Across your body. And to the side. And then in to outward and out to in. Good. Go ahead and sit. I'm going to test the strength of those muscles against while you're sitting. Go ahead and bring your knees up. Good. And back. And push out. And push in. Good. Next, we're going to check your knee. I'm going to check for full range of motion while feeling for any crepitus, which is like a grating of the bones on cartilage or the bone on bone. A little bit of crepitus there. A little bit there too. Do you have any pain when you
No.
move? Okay. And next, so I want you to go ahead and do some, well, actually kick out your knees against my hands. Okay, and bring them back. Okay. Next, we're going to do some fine motor movements. So bring each finger to the thumb. Good. And I want you to bring the heel from the knee, of the opposite knee down the shin into the ankle. Good. Same, and good, and back up. Same thing on the other side, down and back up. We're going to assess some gross motor movement. So go ahead and stand up for me. Do a little bit of a squat. Good, and up, and just jump. And good. I noticed that when you walked that your gross motor movement was good there.
Good.
So that concludes our exam. You were overall normal. Very good.
Perfect.
Awesome. Thank you for giving me the opportunity to examine you.